It's supposed to work like this. A sick patient enters the ER, faces an intake clerk who immediately assesses the big question. If your symptoms match Ebola, where have you been? Somewhere in that process at Texas Presbyterian, there was a breakdown. The Liberian man sent home instead of placed here, inside a secure, separate isolation room where hospital staff could know for sure if the patient has Ebola.
Obviously, there was a misstep. What do you do at your hospital to make sure that the communication is flowing between the staff, the patient, and everybody knows what's going on? And do you rehearse this? Do you drill this?
We do. And part of that drill is general disaster preparedness. Part of the drill is always gearing up for when we know that infectious disease is going to be heightened in our community, whether it's the flu or whether it's a respiratory syncytial virus or any. The screening process, again, starts in triage.
Dr. James Dentien at Baylor's emergency room says since the first of this year, this hospital, just miles from Texas Presbyterian, has trained its staff how to isolate a patient and protect itself through masks, gloves, protective clothing, and only enter through what's called the warm room until test results can determine exactly what is wrong.
And that's what this is. This is not being used by anybody else. This is not an overflow room. This is an isolation room specifically for any kind of infectious disease.
Correct.
Ebola included.
Correct. And we have more than one of these rooms, and we can use them in day-to-day operations.
Dentien says his hospital is ready, but infectious disease experts say this level of readiness across the U.S. is only now being addressed.
We've seen that hospitals now are downloading paper-based guidance plans from the internet, and they're now working out how to do the management, how to do the implementation, and how to make these things happen to ensure that if they do unfortunately get an Ebola patient, everyone in the hospital is going to be safe.
And it's not just hospitals that need to improve their response. This December 2013 study by the Robert Wood Johnson Foundation and Trust for America found a majority of states scored poorly in their ability to control infectious diseases. The study's executive director quoted as saying, "The bad news is that we found major gaps in the country's ability to prevent, control, and treat outbreaks, leaving Americans at an unacceptable level of unnecessary risk."
Drew, I mean, it's pretty incredible when you think about that. Texas Presbyterian is supposed to be, relatively prepared in a state that's certified to conduct Ebola testing, but they just seem like they weren't ready.
Well, they certainly have all the bells and whistles to handle the problem, but this wasn't about bells and whistles, Aaron. This was about a human error. I know that the hospital's trying to pass off this idea that, much of the information wasn't effectively communicated, but really this is about training. A guy comes in symptomatic of Ebola, and he says he's from Liberia. There should be flare guns going off inside this hospital, and he should be whisked away to an isolation. Instead, they sent him home, to potentially infect more people. So I think when this is all said and done, Aaron, this hospital is going to have some tough questions about training, drilling its staff, and being prepared to pass that information to the next person with the urgency it needs.